I'm going to go ahead and start. I see a lot of people in here. So hi, everyone. Welcome. I'm sorry I was getting some technical things done, which clearly is not me. Nina is fantastic. She's who you see when you come to the clinic and you get your pictures taken. And everybody says, oh, I don't want my picture taken. But we use it to, as you'll see today, we have some good before and afters. And we use those mainly just for you, for your chart. Some of the bigger ones you're going to see are actually people that I work with that are super nice and allow me to do all kinds of things with them. And then we can take close-ups of their face and all of that because they feel super lucky to be, you know, shown in photos and things like that. But a lot of us are private and that's totally fine. So today, it's our very first peel event. Welcome. I'm excited to do this for you guys. It's a big, scary word, peel, here at the clinic. Whenever I say the word peel and somebody's new, they go, oh, I don't think I want to peel. I don't think I want to peel. And I'm thinking, oh my goodness, why? They're so great for your skin. Not only do they help you from a beauty point of view, meaning hyperpigmentation, fine lines, pores, all of those things, but they actually help you from a health standpoint. So when you come see all the dermatologists and they see some of the actinic keratosis that might be forming or things that might look a little bit scary to you that you're thinking, oh, it's been here a while. It's, you know, it's a little bit itchy. It's a little bit red. We can peel some of those off with a little bit of an aggressive peel. And I find that to be really interesting. A lot of people don't realize that. Having that said, there's also many levels of peels. So you can start in the little baby pool and gradually move your way up to a big one, or you can set aside time and know that you're going to do something kind of a go big or go home, which is typically what I like to do, but it's not where everybody wants to start sometimes. So I think today what we're going to mainly go over are the peels because they are scary. And then we have two wonderful treatments that are just a little step above a regular old-fashioned facial, which would be the Diamond Glow and the Skintrinsiq. Something we didn't really cover is Hydrafacial. That one's been around a while. Most people have already tried that. We do offer that still at our Willoughby office, and we do like it. So we encourage you to, if that's one of your favorites, you can certainly go there. We're going to have a few slides today. They're little demonstrations that we put together ahead of time so that it didn't drag and things like that. So Nina is going to start out with our Skinmedica demonstration. It was done on a patient of mine who volunteered, and it has a lot of impactful information on it. So one thing I want to say before we start that video is we are going to be offering specials throughout this whole thing, and we couldn't come up with an exact one because we feel sometimes when we sell packages, we're basically sticking you in something and then you have to follow it until you're done. And sometimes you want to try to change those things up. So something that we decided to do is we're going to let you pick and choose what you want. You'll be able to choose 4 treatments that we talk about today. They can be at any location. They can be in Westlake, where we have the Diamond Glow and peels. They can be in Beechwood, where we have everything. We have Skintrinsiq, Diamond Glow, and peels. Or they can be in Willoughby, where we have the Hydrafacial and all of our peels. So you can then buy 1 Diamond Glow, 1 Skintrinsiq, 1 peel, and your 4th treatment, you would get $100 off. You can buy them in a package. You typically have a year to use any package, and they can be mixed and matched. And when you buy a peel, you're not necessarily buying a specific one. That's the biggest thing that I want you guys to learn out of this whole video is I can critique it. Cassie can critique it. She also does peels with me, and Annie will be doing some peels at our Westlake office as well. She's our nurse practitioner. So, you know, what we do with you as we look at your skin, we figure out how much retin-A, how much sun exposure you're going to have, how you're feeling about it. Are you like, okay, Jill, okay, Annie, okay, Cassie, I have set aside time and I'm ready. Okay, well, that means in 48 to 72 hours, your skin's going to feel pretty well with us. So I encourage you to try to do it from that advantage point simply because it is winter time. It's when we like to run our lasers. It's safe as long as you're not traveling to somewhere sunny right after we do a procedure like that with some downtime. We find that's the best. So we're going to get started with our first, I think it's about 6 minutes long. It's very full of information about the peels. This is Skinmedica Rejuvenized. So we are going to be performing Rejuvenized peel today. This patient has very good skin and very good condition. It does tend to be a little thicker and have a little bit more acne once in a while. We start with the #1 solution, which is a prep. It removes all the oil off of the skin so that the peel absorbs evenly. I can't hear it. Smells a little bit, so we like to leave the fan on.
It's a little alcoholic.
Yeah,
That's not bad.
nope. This is the Rejuvenized peel. It is the strongest of the Skinmedica peels right now. That is considered the prep there. I like to apply, they tell you to do it with the cotton. I usually do it with the Q-tips. Reason being is that the product is not being absorbed into the cotton. You're actually using it nice and evenly on the patient's skin. Obviously, we want to avoid the eye area, but get close. We don't want anything dripping into the eye. Working underneath the eye area will help to smooth soft little lines under the eye, give a new fresh texture to the skin. I always like to say peels are like teeth whitening. I think they brighten your skin so beautifully and kind of hit a reset button at the end of summer to get rid of all of the dead skin that you sort of collected on your little trips to the beach and the pool with all the layers of sunscreen. This patient does a very good job with sunscreen. You can see that her skin is not tan. She's Italian. She has a beautiful tone, but she's not suntanned at all. We're going to work on the soft little pigment here on the sides. After a series of 3 or 4 of these, which should be done once a month, she will notice much brighter, healthier looking skin tone. Her at-home products will work better, whether she's using all prescription or partial prescription, partial cosmeceutical products. That does vary from patient to patient. Their lifestyle, medication, what their goals are. If you are using prescription skincare, we do have you hold the use of the tretinoins, hydroquinones, and all of those types of products for 1 week. If your skin feels normal in 1 week, you can go back to the prescription. If it does not, we usually have you wait up to 10 days. Winter time tends to be a little harder because of the furnaces being on, so it makes our skin not want to bounce back as quickly as the warm humidity and all of that. It tends to actually help our skin more than what we realize. This can be done full face, neck, and there can be a smidgen left over for chest. So again, this is layer number 2 in the Rejuvenized peel. Layer number 3 is going to have a little bit of resorcinol, retinol. It's really going to make sure that the patient peels well. Some of the soft little frosting you're seeing is because she uses medical grade skincare. That's actually a good thing. It means she's going to get a nice peel. Typically, our faces can take a little bit more than our necks. Our necks want to give us a little bit more pushback and little irritation. So you may have to use like a Vaseline on your neck, where your face can sometimes take a little bit more. So now we're going to move into step number 3, which again is going to be the retinol and resorcinol. You're going to notice that it has a yellow little tint to it as we're applying up over top. These peels are self-neutralizing. You do wear them home. If you are an early morning patient, you can wash your face before bed. If you're a later in the day patient, we usually require you to sleep in the peel. During the wintertime, that can sort of be bothersome because your skin can feel quite dry. So as long as usually you're noon or before, you can wash your face around 10 o'clock before bed. And you see it has a light little yellow tinge. As it tends to oxidize during the day, you will notice a little bit of a yellow hue starting to get a little darker. You can always take a bronzer, a mineral bronzing powder to put over top. And we just don't want you to do any liquid type foundation because it will liquefy the peel. I would rather you stay inside, clean out closets, aren't really in the sun. You can't go to soccer games and sit outside for hours, anything like that. During the week of the peel, I just sort of want you to have as minimal outdoor time as possible. So winters tend to be the best. I also think these are excellent to prep for lasers. If you do 3 or 4 of these and get your skin in really good condition, then the doctors are able to choose really great laser appropriate for every patient to give you an even better outcome. Okay, feeling? Okay, Bernie? Okay. A little tingling. Okay. Some patients experience more. I think the healthier the skin, sometimes the more burning you'll feel. You definitely respond very well to peels. So, and the one thing that I want to say is that, you know, I feel like when you're keeping your skin healthy and wanting everything to stay younger and firmer and tighter, the pores to be better, you want the surface of the skin to be in the best condition it can be in. Peels will really help you achieve that quite quickly. There's not many people that walk the face of the earth that don't need one from time to time. So then we would finish with a nice sunscreen. Again, if you don't want to liquefy the sunscreen, you can do a Color Science brush over top. Okay, so now we are back to discussing. One thing I want to say is if you were Carmela, coming in that day with no makeup on would be great. I could then use the prepping solution that would get rid of oils, anything like that. So basically, if you take a shower, come here and put nothing on, your skin, your pH level will kind of reset on its own. So I can use the prep solution and go right into the peel. You're going to go home and wear that. And in 48 to 72 hours, your skin will start to peel. And peeling generally lasts a couple of days. It's not all day, the entire day, usually. It's typically sometimes here around the mouth, especially now when we're wearing more masks. Then it'll sort of spread. Some people will say, gosh, I even had a little line of demarcation on my cheek, and I really was wishing this would peel, and a day later it did. So it won't all just sort of go all at once. It kind of lets go in different ways at different times. It's kind of unique. Best when you don't wear makeup for that, because you just sort of see where your makeup is coming off and staying. If you liquefy it a little bit with a thick, nice moisturizer, we usually, you know, something reasonable that you can put on all the time is kind of nice. Sometimes we do a Veen. It's pretty reasonable. We have Vana cream, Dr. Parker likes. It's just something very basic, boring that you can put on all the time, and then get back to your more expensive, good retail products on a regular basis. So then at the end of the peel, you could go back to using your prescription products and some of your regular products for that 7 days of the peel, meaning the day it was put on when you saw the video till the time you're probably done, you would be just using moisturizer, sunscreen, and laying low. If you can also prevent washing it a ton, like some people are like, okay, some of this dead skin came off, the rest of it is out of here, I'm going to get rid of it. It's best if you kind of leave it alone. You could take little bitty scissors if you're that, you know, crazy, really want it off. It's just making you nuts. You can do that. It's better than rubbing water all over your face and kind of just irritating it, trying to get it away. This time of year, everybody is so dry and everything is just, it makes things more irritated. Not as bad in the summertime. So we're going to get to some of these pre-photos. This young lady actually had, okay, I got how much is the peels? The peels start, a half a peel is a very light one. It's 125. Those are done typically with the machine. So with the Diamond Glow, with the Skintrinsiq, you can add a half a peel. They're 125. They're not part of the special because not everybody adds them. So we'll just let you add that in on your own if you would like to, on a, you know, time by time basis. You may come one time for the Skintrinsiq and say, I just want the Skintrinsiq, I'm not adding a peel. And you may come the next time for a Diamond Glow and decide to add a peel. So we're kind of leaving those alone. Those treatments, the Diamond Glow is 225 to 200. Our Skintrinsiq is 200. The lowest level peel would not be considered a half a peel. It's 160. So that would be Vitalize. And then some of the other PCA customized are going to be in that 160 zone. And then your larger, your stronger peels are 250. And there's space in that 160 zone that we can create different peels for you. And there is a lot of space in the 250 zone. So the price never goes up from there. So you could always, if you're nervous, you could do a Diamond Glow with a half a peel and see how you do. a Skintrinsiq with a half a peel, see how you do. And you're like, okay, then I'm going to try the 160 peel and see how I do. It's like dipping your toe in the water. The biggest thing is you may not peel a ton, but for some people that's perfect. And if you're like, okay, now I'm ready, it's treatment number 3, I'm going to do the big one, you can do the bigger 250 peel. So I think I would like for you guys to sort of think about how you would like to do these things. And sometimes it's your schedule. It's okay, for the month of February, I'm not doing anything. I'm going to do the big one first, get all the dead skin gone. Then I'm going to start with, you know, a diamond glow. You can do it that way, or you can start into a, you know, a more reserved sort of moving in slower and do something on a lower scale and then do the big one for the end. The closer we get to summer, the harder it is to do the big ones because you peel. I do have a lot of very loyal people that do it in the summer and they do amazing. So I have a giant, huge, for years and years, repeat peel business. And I really think all colors, African-American, very dark ethnicity, beautiful skin, that their friends say they cannot believe they're getting peels, and all of the dark hyperpigmentation that they have goes away. They're very loyal. They love it. I really should have tried to find one of them. That would have been amazing to have some of their before and afters in here, but this one is really, really nice. We're going to go over this a little bit here. So we see the pre-treatment. She's got a lot of dark hyperpigmentation here. You know, they're even inside of the acne spot. That was maybe something that she would have needed to have injected because of the swelling, the achiness of it, you know. So doing the peels sometimes will help to kill some of that bacteria. It'll add into what the doctors are giving you as far as your dermatology treatment plan from our dermatologist here at the clinic. And then, you know, when you go to a post-treatment picture like this patient was really happy. I personally, at this point, would have said, let's try to do some lasers and things like that for you. They can then work on some of the areas that you see peaks and valleys and things that they can really get that skin bright. So when I say, you know, do a series of peels to get your skin to a really healthy clinical endpoint before laser, there still is some time to clean up with the laser, and the lasers do a beautiful job. But typically, if we have somebody who has a lot of very nice dark tone to their skin on a hydroquinone for a while prior to the lasers and things like that, then they're not as scary to do. They can do them a little heavier and know that your outcome is going to be beautiful. So we'll go to our next photo here and see what's next. This is a patient who really didn't want her face used, which is totally fine. I thank her for just her beautiful forehead. So she actually had lots of pigment, was in the sun a ton. You know, it just all of a sudden crept up on her and it bothered her. So this is Obagi New Derm system along with chemical peels. And you can see where she got brighter and healthier. Again, it's a very nice example of getting to a healthy clinical endpoint, meaning if you would have just come in and lasered her at this pre-treatment level, it would be very hard to get her to this post-treatment side. This patient was doing very, you will know what the diamond glow is, yes, at the end here. So what happens with this patient is that she, every day without me, is using hydroquinone, retin-A. She's on a very regimented home care system to try to get her skin to brighten as much as it can. And then she backs off for a few days because I want to do very strong peels. So that's how we got her to this clinical endpoint. So again, in this photo, I still think she needs the doctors. I still think she needs some laser if she wants it completely gone. I think hers has even gotten a little better from this, even from this after photo. So I am going to go over what the diamond glow is. Yes, you're actually going to see a live version of that coming. So we'll go to our next slide. So this is Sweet Libby. She works in the back. She does have beautiful skin anyway. However, she's a little bit oily. So what you're going to see with this is she did not peel heavily, but she peeled nice. If you were to zoom her face, you would see the pores smaller, which I will show an example of that in the next photo. But she's as someone that works here with us at the clinic, and she said, I've had other peels and I didn't peel as much. So I was very happy that this peel made me peel. It was not uncomfortable. She definitely said, go big or go home. I just want to do it. And you would look at somebody like her and think, gosh, I don't even know that she needs it. Her skin is beautiful. But if you look at that post-treatment, it is better. It's brighter. It's healthier. She would maybe just wear like a tinted sunscreen or a tinted moisturizer instead of a makeup, which is really what a lot of people want to do these days, especially because everything gets on the inside of our masks, which is totally annoying. So if you can wear the least amount of makeup, I think that's usually everybody's hope. And I think too, as we age, it's better to not wear it. I know, you know, without Botox and some of the fillers and things that I have, makeup just sort of sits in there and it can get dried out, especially in the winter months. So we'll go to our next slide to see our next patient. This is Sweet Nina, who takes our photos. So if you get really close, I don't know if you guys can blow these up on your computer, but she is someone who has extremely sensitive skin. Like, she can barely use anything. She's definitely on a low grade retinol. We did that very slowly. Her Visia pictures with only one photo, which is where we look at your pores and all those different things, they got brighter, healthier, and everything. She said, I feel like my skin was really cleaned out. And what I want to say is, so many people come in and say, I want a facial. I want you to dig all my blackheads out. It's almost impossible to do that. When you see this pre-treatment photo of everything a little bit clogged, her skin was drier, it's winter, and then you go over here, look at the brightness of the pores, how much they're cleaner they are. I'm basically taking all of that dead old skin at the surface and dropping it down so that everything that's sort of stuck in those top layers of skin will then brighten and everything will come out. About how long will the effects of the peels last? So the effects of the peels last, I mean, they really don't go away if you're using good prescription products, at least retinols, and you're keeping your skin, everything moving, the cells moving forward. So peels basically take from your top down. Retin-A, when you're putting it on, it drops down to the basement and it kicks on your cell drive. So it makes those cells shift and move. So you're basically closing that gap down of everything that you're not liking. When you see some of the dark spots going away, the hyperpigmentation subsiding, fine lines, her pores, things like that. I always try to teach you guys, dead old skin is like a trash compactor, right? As the years go by, you're putting all this stuff on it and it's just kind of hydrating and just compacting everything down on your skin. Peels will just go through and blow that away. So once that top is gone, it takes a while for it to build back up, but it will. So typically, you know, you do them, you could do 2, it depends on the skin type. You can do a series of 4 and then maintain with 1 or 2. If you're doing Retin-A, that helps a ton because you're resurfacing from the bottom up all the time. Then when you get into like the machines, the Diamond Glow is going to power wash you nicely, infuse the products nicely. So there's different things that you can do with different treatments that are all non-surgical. It's just, if you have downtime and you do a big peel, the effects of that last much longer, several months, I would say. People are really, really happy, especially using a stronger Retin-A. So Nina said she was surprised. She was a little nervous to do a peel. Definitely someone that can have an allergic reaction, for sure somebody that can be neon red, and she did extremely well. So we were very happy with her peel. And I tried to work on some of the redness for her too in the sensitivity zone of, she actually had the PCA peel, and hers, I did some sensitive with some retinol combined. We have a couple of different brands that we use. So, okay, we're gonna go to the next slide. This is Shane. So Shane started with us a couple of years back now. Shane is here doing your makeup when you leave. So Shane's big thing is uses lots of Retin-A. Skin has improved tremendously over the years. And so we are really excited about the fact that when you see some of the areas here, they're much less of the acne and things like that. Shane is young, so breaks out a lot from time to time, and then other times not one spot for several months. So that's always kind of a catch-22 with peels. We want to kill the bacteria, but we don't want to dry you out tremendously. So I think here you just see the sallowness, the brightness of the skin is so much better. You can see that if you did a zoom on the nose and things like that, which we're not doing today, but if we did, you would also see those pores, everything that was from a close-up standpoint, so much brighter and healthier if you were being picky, like in your magnifying mirror. I try to teach you guys, nobody can see you like that, but you know, if you really are trying to really look closely at yourself, this is where you can see a really nice change with peels. I think Obagi also helped Shane. So there's many things that kind of got him to this clinical endpoint that's really, really beautiful. But, you know, we just got to keep the healthiness of the skin at the forefront. And obviously sunscreen is a big component here that we see, that we don't have a lot of sun with this patient, and the skin stays beautiful because it's not free radical damage is not kicking in and making it age early. So we're going to go to the next slide. Okay, so this is our Diamond Glow presentation here. So this will do a nice little explanation on the Diamond Glow, and then I'll answer questions after this is over. Clinic. We start by making sure the patient's face is cleansed. We assess the skin to see what grade of exfoliation we would be using, that we would be twisting onto the handpiece. Inside this little handpiece tip here that I'm going to show you, there are different grades of metal chipped diamond so that we can do the proper precision and exfoliation of your skin. They're all shown here on this brochure. Next, we're going to apply a plastic tip, and we're going to be putting the TNS Essential Serum through the handpiece, where the handpiece slowly moves across your skin. It exfoliates, extracts, and infuses the skin with whatever of the pro infusions that we use. If you are a Skinmedica loyalist, we find this procedure is highly sought after. It makes your skin brighter, fresher, healthier, smoother. It helps with fine lines, roughness, and dryness, dark spots and discoloration, dullness, and skin congestion. At the end, you can add one of the Skinmedica peels very, very lightly to promote healthy cell turnover. This would be considered more of a medium depth of the diamond tip being used right now. The first pass has the grit attached to it, and the second pass does not. It's a clear surface that is smooth so that you can deposit as much of the product in without doing any exfoliation during that time. We like to say that it's a lot like a power washer. We feel that your skin is being cleaned at the same time, removing debris at the same time as the product is being deposited. Today, we are depositing a hydration. For this patient, we have the TNS Essential Serum. Infusion, we have one for acne. We have vitamin C, and we have skin brightening. Those are usually chosen based on each patient's wishes and their determination of how fast they would like something taken care of. These are very nice treatments to just get ready to go to a wedding or a party of some sort. Not your heavy hitter downtime products. It's going to be more, feel brighter, healthier, rejuvenated. We will be removing dead skin. You can see she has some of that buildup here. This is a heavy retin-A user, so she does peel quite a bit, making her face a little bit more flushed and red than some people would tend to be when they get this treatment done. But it still is a very nice treatment for her. It can be used on all Fitzpatrick colors, ethnicities. The other nice thing about this treatment is if you feel that you are fighting pigment or acne, we can do a series of 6 of them for you. We rotate those every 2 weeks. So it's 1 every 2 weeks for a series of 6. A little more aggressively done if you have pigment or acne. Most treatments can have 2 of the liquids infused. Today for Susan, since she has a lot of peeling going on, what we're going to do is just the hydration. So we're going to make one pass again with the grit and one pass with the smooth. Typically when we use the TNS Essential Serum, that is also only one serum. When you are doing brightening, vitamin C, and clarifying, we use two, so the hydration would follow. She doesn't really need brightening. Her skin is beautiful and bright. She doesn't have pigment. Very heavy SPF user. So she's very, very conscientious of the sun and does not put the things in the sun at all. It's true. No, you really don't. I mean, there's not a lot of people that can say that. So you're very, very careful with it. So for her, she could do the TNS Essential Serum, or she could do the hydration. We picked hydration today because it's winter. It's cold outside. It's a great time to have hydration added to your skin at any point. So now that we've done all the way down to her collarbone, we are going to take this tip off, unscrew this metal tip here. Turn that off so you can hear me a little better. So this is where the clear tip comes into play. You can see at the top it's very shiny. There isn't any grit whatsoever on there for the patient. So it's going to feel much more smooth. You're going to feel a nice the product feels cooling and it just glides very nicely, so it feels very comfortable. This tip can also be used around the eyes and around the lips for putting hydration in those areas that can have more delicate skin, especially in the winter. We don't want to upset around the eye area there. So now we're going to make the last pass here with the clear. And at the very end, even though she's peeling a little bit, she has decided that she would like a soft chemical peel. But today we have chosen the Rejuvenized peel by Skinmedica. That is also the maker of this machine and the infusions that are moving through the hand piece. So if you are a Skinmedica favorite, you love Skinmedica home care, this is a wonderful addition to your home care because it's all of your favorite products that you're already using at home. Very, very nice, and you can look really, really great for a trip or weddings, events, things like that. This would be a little slower if I was doing it in real life with you here. I'm just going to move a little bit faster for her so that we can then carry on into the peel. I don't want this to last too long for the demonstration. So I'm going to go back to the other side here. You can see on this pass I'm not getting as much dead skin. There's a little, but she had quite a bit on that first one. The other thing that they love to announce with Skinmedica is the waste jar here. If you have a patient who has a lot of clogged pores, you're going to see a lot of different blackheads and different things down in the waste jar. Some of their hashtags are Waste Jar Wednesday and what's in your waste jar. Those are fun. That's a big thing for them because they like to show all of the impurities that were taken from the skin. I always say that's how you choose something correct for your patient. For her, she doesn't have impurities necessarily. We just decided to add straight hydration to her skin today. So we did a mild diamond tip, and then this is, of course, the smooth. It is the mildest of all of them, and you can see she still flushes beautifully. Some of that is her aggressive products that she uses at home. It does make her face a little more red from time to time. So we don't worry about that. So we're just going to work on finishing her neck here, and we are just about down to the end of the entire jar, which is what happens when we are doing 1 jar on a patient, we would use the entire thing. And when we use 2, we use a half of each. These treatments are customized for you depending on your provider, what your doctors are doing with you. They are a great no downtime procedure. And the peels are not absolutely necessary at the end, but they are a very nice frosting to the top of the cake. They're a very light peel. She, of course, is going to look red because she's starting out red. However, she probably won't peel very much. It's going to be more that now that the skin is open, all of the nice brightening properties that come in a luminized peel are going to be able to penetrate down into her skin even better, because we removed the dead cells that would have soaked up some of that product had we have done it independently. So we are going to move right into, I could go back over the eyes a little bit more, things like that, which we also do just to finish out the little tiny bit of liquid that we have left. But you can see she's very comfortable, nothing is hurting her eyes, it's not dragging, and she doesn't have any problems by her eye. Still comfortable, Susan? Yes? Okay. So, got your little mouth area here. This is really, really nice. We can actually turn the machine down and go literally right over the lips. A lot of patients remind me to do that. It's their favorite. They really love having that done. I've already opened up a peel behind me. So
if you want to save time, we probably can move on from that. Basically, what we're going to do next is just apply the light peel.
It's going to be really, really light.
So the peel goes on and you actually go home with it on. So we will just wait 1 minute before we start this one. So with the Diamond Glow, again, very easy to do. You do get a little flushed and a little pink. That's usually gone in an hour or so. Susan has a big histamine response, so she gets very red, as do I. So it's something that's good, actually. It won't stay for a long time. Not like when you're red with a peel and you're red for several days and you almost wish you weren't. It's a different kind of a red. So again, we choose those different grits that fit onto the handpiece. It's very exfoliating. You're deeply cleansed. You know, Dr. Parker does love to say it's like a power washer. And I think it's a very good way of thinking about it. Like when you power wash a building, it gets brighter, cleaner, healthier. So if you don't feel like you need power wash, then that's probably not for you. But some certain times of year, I would say, that's why I say mix and match. At the end of summer, you did a lot of sunscreen, a trip, maybe you weren't using your skincare as much. You didn't feel good. You want to come and just get all the junk out of your pores. That's a really good way to kind of clean everything up and kind of hit a reset button. So the next one we're going to talk about is Skintrinsiq here. This is a brand new treatment from Obagi. So we were one of 7 practices across the country to do a clinical trial for them. And we got the machine a few months back. I did 10 patients, 3 treatments each, excuse me. And what was really interesting about it is some of them were husbands of my patients, which was really kind of fun. Some of them were people that had never used Obagi ever. So I kind of wanted to just see how their skin would improve with just the light. So a little bit different. The technology here is going to be all LED based. You're going to see the handpiece making different lights of blue, red, and things like that to infuse the products into the skin. So with Skinmedica, the products are going through the handpiece and pass over your skin. With Skintrinsiq, I'm mechanically putting the product on. They ended up using my before and afters for the clinical trial. I was really excited, and I'm going to speak at their national sales meeting in the beginning of February for them on the treatment, on the machine, and all of that. So I was excited that they selected my photos and things like that. So this is a little bit different. If you feel like you use a lot of Retin-A, your skin's a little sensitive, you're not sure what you want to do, patients really feel that this also makes their skin extremely bright. People say, I feel like I got plugged in. I feel like a glowworm. My products work better at home. So we are going to, thank you very much. I appreciate that. We're going to go ahead and show Lisa. Lisa was nice enough. She's a patient and dear friend of mine for years. She was nice enough to put her pretty little face down here for me in the live form. So she we're gonna demonstrate the Skintrinsiq next.
Our Skintrinsiq treatment by Obagi. It is a new machine. We are one of 7 offices that were selected across the country to launch this new technology. The machine does a really nice job with the LED light technology. It has a blue and a red light capability that can be simultaneously changed as it glides softly across your skin. You're not going to feel any of the diamond tip like you would in the other procedure. This one is very soft, it feels very smooth. Patients say their skin is glowing, brighter, healthier, and that it lasts for more than 2 weeks. We think this is a very nice treatment for people that are Obagi loyalists. We can customize the serums that go on to the face. We would choose things such as vitamin C, Elastoderm facial serum, Elastoderm eye serum, and we can actually put them in different sections of your face and penetrate it deep into the skin with their light technology. We are very happy with this treatment. We also did clinical trials for them that were very successful here at the clinic. 10 patients participated. They had to stop their prescription products during the treatments, and at the end, all of them were very, very happy with their skin. They felt brighter, healthier, red carpet ready. Some of them said just a beautiful, healthy glow. They wore less makeup. There was no downtime. And you can also add a peel to this, which is the Obagi Radiance peel. It can be put in the middle of the treatment. If you are an Obagi loyalist, you are using Retin-A on a very heavy track, as most people tend to do in the winter. You will not have this treatment feeling aggressive. Your skin is going to feel like it had a big drink of water. It's brighter, it's healthier. We can get right up in the eye area, as you're seeing here, with the handpiece gliding across the eye area. It's very, very nice. So what we're doing now is making everything nice and open, clean, and ready with this red light. You're going to see that our skin starts to get a little bit flushed and bright. You're starting to see the nice flush pink into her skin getting nice and bright, partially from the suction and partially from the red light. Wakes all of the cells up, gets everything ready for the next process, which is going to be a very light, soft chemical radiance peel. Also by Obagi, it can be put in the middle of the Skintrinsiq treatment with very little downtime, usually none. The skin just gets really nice and bright. And then we go on to the final infusion, which is completely customized per each patient's wishes. I also cross-customize sometimes, where we do some firming on the neck or the chest, and we may do skin brightening, which would be Obagi FX, vitamin C, eye cream, and then we finish with a Hydrate Plus product at the very end. We'll move into the peel process. We're now going to evenly apply the Radiance blue peel. It's very light. She can leave the office today and go to work, go about her day, put makeup on if she wants, although she's mentioned lately that she only wears a nice little cream blush and doesn't feel like she needs makeup as much anymore, which makes me very happy.
We can go to the infusion part if you want, Nina. Just a little bit at the end. So the peel here was put on. This one needs to be neutralized. So then what I do towards the end of the treatment, so we can answer questions and go over some more things here, is now we're putting the product in, which I think is really beneficial. So I mechanically put the product in and I'm infusing it with the light. We'll show a little bit here in a few minutes. There's a little video from Obagi on this treatment that you can see how the light, the different levels of the skin that the product gets to. So people say this is very relaxing. They really like it. People that did have some pigment that were not using prescription products, their before and afters are being used in California for some of the hyperpigmentation that subsided from just non-prescription penetration of the products here with this light. So we were very happy with that. Since it's a new technology, we really weren't sure. I sort of got a hold of it and made it my own and kept going over things with Dr. Parker and brainstorming with her about things that she thought we should do to add. One thing that Lisa is saying here is that she just really feels that as an Obagi loyalist, it sort of took her products to another level when she got back to the Nuderm. I was very happy to hear that. She was on an antioxidant track when she did, meaning more vitamin C's and things like that. So a question that came in was something about pigment. I would definitely, well, God, I don't know if I'm supposed to say that. We'll say 50s. Is that okay? Can we do it that way? I'm 53. She's just a teeny bit older than me. So we'll go. I just never want to, but you know what? When you look good, who cares how old you are, right? It's all right. So she is also very careful with the sun and very careful with her skin. So she did have a little bit of pigment when she started the clinical trial with me. She said, you know, I fell off the bandwagon. So yes, right. The patient who asked that question said, right, I'm 52. So one thing is somebody said about pigment. I would go with the peels for the pigment and the prescription skincare for sure. So anybody that attends this gets a free consultation. You can come in, you can talk to me, we can make a treatment plan. Back to these specials, if you missed logging on early, the specials are certainly 4 treatments. You can mix and match them. So if you want one peel, one diamond glow, which is very much, yes, like a Hydrafacial. Somebody asked me that question. It's just, there is a metal tip inside. It definitely exfoliates you deeper, I think, than the Hydrafacial does. You also are going to have only Skinmedica products being infused to your skin. So that TNS infusion is a big crowd pleaser. Everybody loves it. You know, that is a $225 price point, but you get a lot impactful ingredients in there being infused to your skin at the same time it's being exfoliated. So when you're trying this, then you can add a Skintrinsiq here, like we're talking about now. So Lisa was the first pass was opening. Yes, it was brightening. Then we did the peel, and then we're doing the infusion, where Diamond Glow, you're actually doing the power washing, the infusion of the liquid through the handpiece, and the peel last. So it's all just a little bit different according to how we do them, you know, and how the treatment is done. They all have a really nice clinical endpoint. And you can just come in and say, I have time to peel. I was gonna do a Diamond Glow. Now I wanna, you know, Rejuvenized peel. I'm gonna do that instead. It turns out I have, you know, 7 days to peel and look a little yucky. So let's do that. So you can change your mind. I let you do that. I shouldn't say, speak for Annie and Cassie, you know, I'm sure they can do something like that as well. But sometimes we do need the equipment, you know, reserved for the technician that you want to see. So we would have trouble if there were 2 Diamond Glows being performed at that time, and it's quite popular. So there's a very good chance that it would be in use if it wasn't scheduled with your provider. So that would be one thing. So again, with the specials, if you buy 4 of any of them, you get $100 off of your 4th one. And they can be mixed and matched, and they do not have to be used in any sequence. So I think they're great because we're heading into spring, right? So if you start maybe with a good peel, and then you think, okay, well, I'm going to have a baby shower, I'm going to have a wedding shower, I'm going to be going somewhere. You can do some of these different skin treatments that aren't like the old-fashioned facials. They're going to brighten your skin. You know, with Obagi, the patients, we took pictures of patients 2 weeks later, and they were still bright, healthy, and still improving. So that is quite good. I would think the exact same would be for Skinmedica. I haven't done a clinical trial for them. They do their own, but I do not have anybody that says their skin didn't stay well for a long period of time. So I think you would just decide between a power washing versus a heavy light infusion. You can't go wrong either way. I think it's really great to try them both. It's kind of like how we use different fillers in your face. We do different types of lasers for different reasons. Mixing and matching is a good thing. Staying stuck in a rut for too long isn't. I think, you know, getting a different provider's point of view. We have a lot of really highly educated doctors here that are amazing. They all have their favorites. So it's good to just, you know, talk to your favorite person, kind of go over what you're thinking with them, and then devise a little plan and execute it. So these are really nice entry-level treatments that are not breaking the bank for you. You know, we've got a $160 peel with multi-capability levels in it. We've got a $250 peel also with the multi-levels that we can increase and customize it for you. If you're somebody that's red, we can try to eliminate redness. If you're somebody that's dark, we can try to eliminate the hyperpigmentation. So there's a lot of different choices. You're not just getting one thing with one choice. So I think that is also, you know, a good thing. And similarly to, we talked about how Diamond Glow, if you have pigment or you have acne, you can do a series of 6, one every 2 weeks. You can do that with the Skintrinsiq as well. We would then customize acne products being infused in, or skin brightening products being fused in. So you can do the same. I think our next video may be how Obagi is describing the Skintrinsiq working. Is that right? Yes. Okay. We're going to watch this. It's not very long. It explains the light technology and the depth of the skin for you.
A new level of medical skincare is here. Introducing the Skintrinsiq system, the first device designed by the skincare experts at Obagi. The surface layer of your skin is a protective barrier against debris, germs, and sun damage. But it also keeps out the skincare products you depend on to help keep your skin looking vibrant and healthy. Other skincare devices remove a surface layer of your skin to bypass this barrier and apply products. The Skintrinsiq device is different. It relies on innovative pneumatic technology, a gentle vacuum that lifts your skin to open channels in the surface layer. Through these channels, impurities can be extracted and products infused. Every Skintrinsiq treatment begins with soothing, cleansing, and toning. Next, the unique Skintrinsiq handpiece is used to extract impurities. You can add optional blue or red LED light therapy for a variety of benefits without adding to your treatment time. After extraction, your customized Skintrinsiq treatment protocol is deeply infused. No matter your skincare needs, there is a Skintrinsiq treatment that's right for you. Products are infused evenly and thoroughly for enhanced results. Simultaneous blue or red LED light can be added to the infusion phase of your treatment as well. When your infusion is over and the Skintrinsiq handpiece is removed, the channels in the surface layer of your skin close to lock in your Obagi products. The gentle, spa-like experience and noticeable results of your Skintrinsiq treatment come with no downtime. Dynamic infusion helps jumpstart the benefits of your Obagi home skincare regimen, so you'll be on your way to a radiant complexion even sooner. Skintrinsiq from Obagi. Experience the next level of medical skincare.
So again, to just, you know, differentiate between the two, you've got the LED light technology, the Obagi loyalists, and we have many Medica loyalists as well. They love, I do a boatload of the TNS infusion. So, you know, people are like, I think it does the most for me. And young kids like the acne one, I think a lot. Your teenagers, your sports, people that, you know, they're like, oh, I wear a mask, you know, it goes across my face, it goes here on my chin. My chin is, you know, even a baseball, I'm sorry, like a catcher's mask or a hockey, things like that. They're like, you know, Jill, I can't get my face clean. It makes me crazy. So if they don't have downtime for a peel, that's upsetting to them. You know, cleaning it out really nicely with the Diamond Glow is a really good choice. So, you know, we have many, many choices. I hope this helps you guys. The biggest thing I want to teach you guys is not to be afraid of peels. So many people are scared to death of peels. Peels can be done in so many different varieties. And once you have had a really good one that actually exfoliates the top well, you really end up a little bit brainwashed by it. You're like, wow, that, like, I mean, the treatment was, you know, I didn't love it for the 3-4 days I was peeling. I was annoyed, but at the end, my results were so much longer. I think that's a really big thing that I hear a lot, you know, so people sometimes they love to hate them, but they love them. And I think it's just, if you set aside time and you're like, okay, that's it, I'm doing it. You know that it's the right time. You don't want it to be when you need to look good, and you're like, gosh darn it, I shouldn't have done it at this time. This just was not good, because it just adds to the stress level of, you know, your face isn't put together the way you want. So do we have any other bigger questions here that we can think of? The Diamond Glow is similar. I covered that. I do think it's a little more aggressive. I think it power washes you a little better than the Hydrafacial. Our Hydrafacial machine is now in Willoughby. It's doing very well over there. You can certainly go over there and try it out. Again, we have Diamond Glow in our Beechwood facility and our Westlake facility. We have peels in all locations. The Skintrinsiq is here at the Beechwood facility right now. So trying to see if there's any other questions that you guys may have. So consults are free. And, you know, oh yeah, her neck does look awesome. So, you know, we always try to tell you guys the peels also are including your neck. I should have said that. I'm sorry. I'm glad you said that to me. So the peels are typically going down here to the collarbone area. So, you know, we want to make sure, we forget a lot, or we get in the pool and we're like, whoo, we're hot. And you tend to sort of wash some of your sunscreen away, but you don't get your hair wet and your face and things like that. So the sunscreen stays a little better on our faces unless we're snorkeling or scuba diving or something. But, you know, we want to make sure we're treating the neck. So Diamond Glow, peels, Skintrinsiq, and Hydrafacial all treat the necks. So I think that's also a very, you know, that $160 price is included in the neck. Some people then go ahead and add their chest. Your chest area is another $250. It is expensive. So we are doing it all the way down to where the bra kind of stops there, to the shoulders. I mean, this is a big span that sometimes gets a lot of sun. People don't like it. I would heavily recommend doing that a little bit before you would do a laser. It'll get that skin in good condition and changing everything over. So I don't know if we have any other, you don't need to know the specific peel that you want. You can just say, I would like to schedule a peel with Jill. I'm not sure what I want. Basically, we'll go over your skincare. We'll figure out what you're doing. More importantly, we'll figure out your downtime and where your head is as far as, are you ready? And if you are, we'll do a bigger one. And if you're not, we'll do a weaker one, and that's okay. So, you know, I think it makes it a little less scary for things like that. Can you do this around the time you get fillers? You know, you can. I would wait a little, let your fillers settle, and that varies from each individual provider. We don't want to do a suction necessarily when you've gotten the filler new. So maybe the peels, after a few days, we know that it's healed, you're fine. Maybe you're a little swollen, you have a little bruising and downtime, and you want the downtime the same. As long as the person that injected you says yes, I think it's fine. But you know, everyone is different. So the doctors are going to have their own kind of regulations, which I always follow. So we just got to make sure that that specific provider that puts your filler in is okay with it. Lips, you know, something of that nature, I'm just kind of close to the border. I'm not going over the lip. So it would be fine. So if you were bruised and peeling at the same time, I would say that's kind of a smart way to do it. Yes. I'll try to teach you to stay home and hide and things of that nature. I think we have a couple more down here. Let's see. How long to do this before laser? So, you know, you're usually healed with peels in 7 to 10 days, and then you can do laser anytime, you know, a month or so after that.
Do you need to see one of the doctors to be established as a patient before seeing me? No, you do not. So what we would do is go and get someone that says, yes, you qualify for the peel. The doctors always oversee everything I do. Annie, our nurse practitioner, can do that as well. And then they just make sure that, you know, we're on the right track for you and things like that. When do we have to schedule the free consult and the first treatment at that time? You don't have to schedule your first treatment at that time. No, you can come in, you can do a consult. I also do virtual consults. So if you are home and you know, some people are in Florida until April, some people are in Arizona until they're the lucky ones. We're still stuck in the snowstorm. I can visually see you, no makeup, iPhone, whatever you have there that I can get right to, you can get to the window. We can just talk about what you're thinking you want to do. I'll type it all in your chart. When you come in, if it's you know, the diamond glow, Skintrinsiq, things like that, you don't have to see the doctor. Peels, I always have you see someone that just knows that you're okay for it. So we kind of go that route, and then your medical history is taken and things like that. So we can keep track of where your pharmacy is in case you have an allergic reaction or something simple. I have an appointment with Dr. Meek, and do I need to separate the appointment with you to discuss the peels? Yeah, you want a little bit of time with me. Your time with Dr. Meek, of course, is so valuable that you want to make sure you two are, you know, on track there. And then, you know, you can always say, I'm seeing Jill next. I'm very interested in her peels. Or if you can't see me after because of the timing, you know, I can just go over to her when we're done, when you and I are done, and then you're going over to Dr. Meek and let her know that you're interested in the peels. And I'm sure, you know, she will give us your blessing at that point. So it's very quick, but it just makes sure that, you know, whoever you're seeing, they are definitely keeping track of what's going on with you and your chart and your skin health. So we don't have a lot of questions, which is great. That means hopefully that you guys felt this was informational. So I hope nobody feels scared of peels anymore. I hope nobody, you realize all the great treatments we have at all 3 locations. You can do a lot of things that are just pick-me-ups, but they actually make you feel better, you're brighter, you're healthier, and it makes your own skincare work better. And don't forget the health benefits that I talked about in the beginning of the peels. You know, anytime we can get rid of a beginning actinic keratosis or something that could want to sort of creep up and cause us a problem, it's going to make your skin healthier as well. So I hope this, I see 2 more coming up. Let's see here. I don't want to miss anybody. Okay. Do you still do the heavy $700 peel? So those are going to be doctors, and they do. You can. Dr. Parker, I believe, does the TCA. You know, we really should see you though and see what you think. You know, a lot of times those are a little more older fashioned. I would say these really, you know, when you saw that dark hyperpigmentation photo in the beginning, that was quite a transition for that person, and it was not a long period of time. Do any of these firm your skin? Yes, they do. So when your skin is, you know, healthier and brighter, it doesn't have all that dead old stuff sort of sitting in the trash compactor that we talked about. So I think that everything is brighter and healthier. So I think we are going to need to kind of wrap up. I'm sorry to do that. Any other questions, you guys can email me, jillg@theparkerclinic.com. And I will see all of you at your consultations. Okay. Thank you so much for joining us, and we will see you next time. Bye.